I've been tasked today with trying to put everything together and reflecting on what we heard this morning. And what an exciting day. But indeed, there's so much that it might take me again an hour or two to really reflect on everything. And I know we are running out of time. But I'm going to try and do a little bit of justice to what we heard today. So I think we started off obviously with Landa that absolutely set the stage for us today and for this symposium. And really speaking about their own experience, but also the need of trans and gender diverse and gender non-binary people to access gender affirming healthcare. And he really reminded us what people are dealing with and what our trans clients are dealing with as they attempt to access this healthcare. Then we listened to Siskiyou with her exciting study that her group did on what is really happening. So she started off with the news at 9 o'clock and informed us that there is now a population estimation. And in their population, it was 179,327 people. And I just wondered how many of our trans people of this 179,327 really had already access to gender affirming healthcare, because that tells us it is 3 people in 1,000. And if we listen to Bruno Pauli's presentation, this is a worry. Where are the trans people? Because they only have a small cohort of people that can access at their hospital. We heard there's good mental health support, and we know that our trans and gender diverse people need mental health support, especially due to the minority stress. And when we listened later on to some of the presentations, I started thinking, oh my word, I mean, we are creating minority stress as healthcare providers. And if I listen to the students, I got a lot of more gray hair this morning, just wondering how much work we still need to do. So we know from Bruno's presentation that, yes, there's good mental health support, but what we don't have is we don't have surgical services. It's very limited. They have a waiting list there of 200 patients. If I think just about the waiting list at Groote Schuur, it's over 30 years. And there's only been 3 top surgeries done this year. That is not great. And only 2 orchiectomies. So we really do need more if we look at the waiting lists. We had the positive news coming from Wits RHI, from the very positive work they are doing at their 4 clinics. We heard this, the overview that Rue did, and the uptake that we now know from people that is on hormone therapy. They are 3 times more likely to be suppressed if we look at their HIV care. So that is brilliant. But we still heard there's a waiting list of 300 people in Joburg. Naomi then reflected on the importance of social workers' contribution in this field and at the HIV Wits RHI clinics. She spoke about solution-focused counseling. She spoke about being active in the informed consent process, the letters to Home Affairs, and then also the difficulties to work in these spaces, and in the end, sometimes landing up working literally in their cars to really be there present within the community. Yoli then spoke about sensitization of gender-affirming healthcare workers and people working in healthcare, and how they then, in the end, brought gender dynamics in to do some of the training, and how important this training is. But she also reminded us how important it is to work with partners and to work with civil society, being it SHE or GDX or SWET or Sisonke, as they work with, but also a reminder of all of us to reach out to our different stakeholders and organizations in our areas, and what a valuable contribution they can do. Sakile brought us more into the space of the hospitals. So we heard from Bruna on the one side in Joburg, but Sakile said, wait a minute, I'm here from KwaZulu-Natal, and yes, I do work also in collaboration with Wits Orange Eye and East London, but how do I do it then also here when I work in KZN? And he spoke about all the barriers that we see for our rural KZN people and how to help them. He reminded us that he is as queer as daylight, but then he also brought in the hate crime that they witnessed, and one of his friends witnessed, just by how he was presenting and performing gender in the community. He then suggested, how can we then also include our traditional leaders, bringing in our wisdoms from our African perspective and spirituality, and how we need to also take hands with our community out there and the society out there. Now we know that if we want to then bring in our community, if we want to bring in our organizations, we also need to take hands with Department of Health. And I think Mina's exciting study that she is doing to look at the economic costs and health outcomes is really going to speak to it when we look at Department of Health and the care there and the results that we are awaiting of her study and how that is going to speak into our work with our communities, with our Department of Health and organizations. So that was healthcare. But then excitingly, we started moving a bit over to our schools. And we looked at Jonathan's and Melinda's study that they are doing, working with educators. And the importance of educators working in the end then with our learners, creating safe spaces with them. But then stopping a little bit and saying to us, wait a minute, but our teachers, our educators need safe spaces because our schools can be captured, and we know there's cancel culture, and it goes even further that our teachers in the end have concerns about their own employment and what we need to also help our educators to work within their school spaces. Then we heard from Dr. Naike about her reflections. And unfortunately, she couldn't join us today. And we definitely send our condolences also to her and her family. But when we look and reflect at her research, we start receiving very concerning findings there. That when they looked at the medical students that needs to do and interact with our clients, we started realizing that men that are heterosexual, cisgender, married, and religious really have issues with trans and gender diverse people. There's a little bit of hope there, though, in our presentation that the more experience brings more acceptance. And if we look at the work that Pia is doing, that says, wait a minute, we need to do a lot of self-reflection as well. And we need to change the university in totality, not just our medical students, because PATHSA definitely is not only about our medical doctors, but also our psychosocial care. And in the end, a much broader society, we start realizing that through self-reflection and also becoming allies, we can do so much more impactful work as we move forward. And in the end, Elma then reflected and reminded us that, yes, we can't create demigods from our healthcare professionals. We need to do interprofessional education. We can't in the end say, well, psychosocial support can't be valued, but we need to start listening to one another, but even more important, to our trans and gender diverse and non-binary folks. So what do I draw then from all of this here today? Well, definitely there's a need for access to gender affirming healthcare. We need to realize where we're going to situate it. Is it going to be in HIV care? And we heard the reflection from Rue that it's always that kind of umbrella that we see it from, and from their clinics, that is their main focus, and from Oren's clinic, that's also the main focus. Or are we going to situate it somewhere else? We know there is definitely in social support spaces, but also then more in your primary health care, and where in medicine are we going to situate it? We celebrate the wonderful outcomes from this RHI program, but we look with anticipation now that we have an estimate of a 3 out of 1,000. What is going to happen then in Department of Healthcare? And Mina's going to bring us some of the costing there, but we definitely need more training, we need more interventions, and we need more cultural competence, and also to bring it into an African context, to do it depathologized, but also bring it back to Africa and not in the Western concepts. We have heard that we need support as Department of Health. We have the Mavericks there that needs to start taking hands, but we also need to support them. But I think also we were reminded again once more that we, each one of us, needs support working in this field. And we need to support our students and our educators. But I think for me, the most important fact today is that we have trans and gender diverse and gender non-binary people there. We had a little bit of people that's out there that is presenting here today. But where are our other trans people? Yes, we can be allies, being it imperfect allies or maybe just good enough. But the voices of our trans people today were very silent. And that is for me a sadness of the symposium. And when I looked at the run-up, I saw only a couple of people that's queer that presented here today. So how do we break this silence? And again, it reflects on the one side about, are our trans and gender diverse people really welcome in these spaces? How are we doing it as allies to welcome in our trans and gender diverse people? Because today we knew everybody was open and welcome to join us today. And how do we then not only be the voice of our transgender, diverse and non-binary people, but also hear the voice of our trans and gender diverse people? We are definitely an imperfect health system. We are definitely imperfect allies. But let's work together and become a safe space for us that's here today, but also for our trans and gender diverse clients. Thank you very much.